Welcome everyone. I'm Councillor Matthew Whittington, Cabinet Member for Community Wellbeing, Health and Care. Just some housekeeping. If the continuous fire alarm sounds, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria's statue in Guildhall Square. I don't think anyone would have signed in, so that's fine. There's no press or public in the meeting. Please can everyone use their microphones and remember to switch them off when they are finished. So start with introductions to my left.
Anna Martin, Democratic Services.
Andy Biddle, Director of Adult Social Care. Councillor Graham Heaney, Labour Group Spokesman for Community Wellbeing, Health and Care, and I've got a bit of an echo. Hello, Councillor Corley, Hilsey Ward.
Councillor Spencer Gardner, Drayton and Farlington.
Very welcome, all of you. We have no deputation requests today. We have no apologies for absence. Any declarations of interest, colleagues? No. Great. So we move swiftly on to item 3, day services charging cap. Over to you, Andy.
Thank you. So the paper before you, highlighted under point 1, the purpose of the report, we're asking Cabinet Member to approve a recommendation to remove what is a current financial cap of £250 a week on charging for daycare services provided through adult social care. You can see the recommendations there that we're proposing to taper the removal of the cap given the amount of money that we're talking about for a small number of residents. So the context and history is laid out going back to 2018 where there was an initial smaller cap on charging for daycare which was removed in 2018. And then moving through into the next page, in 2020, there was a motion adopted at full council to introduce a new cap, and then the decision, the points that were wrapped up in that decision on the 7th of July of 2020 are highlighted at points A to D. It's worth bringing to your attention the point C, that this cap in 2020 was to be on a temporary basis until the publication and implementation of the anticipated government reform for social care. That reform is currently parked, I think is probably the right word. It was due to be brought in October of next year, but that was then stayed by the previous government, and we understand from the current government that that's also going to be stayed. The finances to introduce charging reform aren't available currently. So earlier in this year, in July of this year, an information paper was presented by Adult Social Care to Cabinet Briefing, who agreed to delegate decision making to Cabinet Member for Health, Wellbeing and Social Care. So we then go on to under point 4, the reasons for those recommendations. We have current financial pressures in adult social care, and there would be an income generated from this change. The impact of inflation since 2020 has been quite significant on the existing cap, were it to be applied. This is an inequitable approach in that there are no other services within the city provided by adult social care that are capped. Everyone has a financial assessment and is assessed to pay according to their means. As I've outlined earlier, the temporary nature of that decision in 2020. And finally, we do have quite a lot of manual administration that we have to do to apply this cap. We have a standardised charging assessment IT system, and we have to do quite a lot of manual workings behind the scenes to make this work. Moving on, we're proposing, because this will be a significant amount of money for 3 of our residents, so we're proposing to implement this in a tapered way. So initially to visit the affected residents and families, both from a social work perspective and a financial and assessment benefits officer, to talk through the options that they have around care and around charging. and whether we can come to give them any advice on other services that may meet some of those needs. We also want to give people plenty of notice, so we're proposing to give people 3 months' notice of this change, and then to start to implement a withdrawal of the cap from January of next year that would finally take full effect in October of next year. There is an integrated impact assessment included within this recommendation, and we've set out there similar things really that we propose to taper the effect, but that the impact assessment talks about the inequity of this current approach as being one of the main reasons for changing it. We've then got some legal advice under point 7, and we have finance comments under point 8. So that's a summary of the paper, but as always, happy to take any questions or queries.
Thank you very much, Andy. Colleagues, any comments, questions? Right.
I have a few questions and a comment. I'd like to ask Andy a question first of all, if I may. Currently, we only have 3 residents who are subject to the cap. Are we likely to get any other residents who would come under it, who are maybe newly accessing services? Because it seems a very small number. I know the cap's been raised to £250, but I was wondering if there's any possibility that there were new people coming in.
Reasonable question. Unlikely, I think, because of the effect of this cap and because of the amount of money we're talking about. I mean, a lot of the people in the city who access services pay quite a small amount toward those services rather than the full amount. It's a smaller number of people pay the full amount for those services. So we think it's unlikely. Never say never. I don't think it very much depends on circumstances. And at least in at least one of these cases, one of the residents has come into certain finances that have included them in this group since they started accessing services. So people's situation does change, but it's unlikely given the amount of money we're talking about and the relative inequalities and lack of wealth that we have in Portsmouth.
I have 2 questions I wanted to ask Matt, if I may, in relation to the port. There's an intriguing paragraph at the bottom of page 2 which says on the 16th of July, an information paper was presented to Cabinet briefing to update the Cabinet on charging. I presume that was a private briefing for the Cabinet. Would you like to enlighten us on what happened at that discussion?
Yes, I mean, so on a weekly basis, the Cabinet meets to discuss various issues that go on around the council, as you can imagine, and we ask at those briefings sometimes for particular where there's been conversations between a Cabinet member and officers. So in this case, between myself, Andy, and officers from adult social care about sort of proposals and ideas and situations that we have. So in this particular case, I asked Andy to come along to briefing to enable the Cabinet to understand what was going on. So it's just so no one's kept in the dark or sprung on something as a surprise, and then moving forward with how to manage this, because there's 2 ways you can do this. I think we've talked about this before at this forum. You can do things through decision making by a Cabinet member, or you can do it through the Cabinet. So that was just really a discussion then to really get the views on the colleagues in Cabinet. We're doing a collegiate effort as Lib Dems, as you might expect, about whether where it should fall, and they were happy for it to come to this forum in particular. So that's what the nature of the paper was and the discussion there.
Thank you for that. That's helpful. I want to go back to the report of July 2020 when this matter came about, because as the report says, a cap was introduced in 2011, and it was, I think, a suggestion. It was quite clear what had happened. I went and tried to find out a bit about it. Didn't get very far, but I can only surmise, and this is purely my sort of speculation, that the time at which the cap was introduced, there'd been a massive amount of cuts to local government spending in the budget of that year. And I wonder if the decision to bring the cap in was to mitigate some of the potential costs on residents, as that might be a reason, but I haven't been able to pin that down. The decision to remove the cap was taken in 2018 to be implemented in 2019, and then it came back in July 20. And the decision there was to reinstate the cap. Interestingly, one of the options that in that paper, and I wanted to ask about this because I wasn't clear what happened, was in option 2 to reinstate a financial cap. There's a sub-option would be to reinstate the financial cap for daycare residents or clients in receipt of these prior to the removal of the financial cap, i.e. those ones who have been impacted, and but then to allow new clients who come on to be charged at the same rate. Why didn't you choose that option, as it would have effectively dealt with the problem? I know it's 4 years ago, so I'm sorry for that.
Yeah,
but that is interesting that I read that, but it
yeah,
wasn't taken up as an option.
If you give me a moment, I will regale myself of that to remind myself in those heady COVID days, as they were.
Because I went and looked at the meeting, and I remember we were in COVID times, and I was yes.
As much as anything to refresh my memory.
Well, can I tell you what I did do? The report was presented, and you asked us questions. You asked us if we had any questions or comments, and I said, well, we don't know what the recommendation is because you had options on the paper, and I said we don't know what you're actually going to propose. And then you proceeded to tell us what you were proposing, but it didn't include that.
Yeah, so I think Graham, going back to it, I think the reason why we took the decision, or I took the decision I did at the time, if I recall, and obviously it would be recorded, so I mean you could go back and do it. From my remembrance, it was because at that point and this was going to be part of my comments, so anyway, thanks for bringing this up, was that because we'd been told we not long come into the 2019 to 2024 governments, and the Prime Minister at the time had made it very clear that the plan for adult social care charging was going to be a priority for the government, and therefore rather than, so effectively the consideration was, well, that's going to be coming. Obviously, yes, we were in COVID, but it was still a case of that was still going to be a priority. Even during COVID, we'd had from the government, and indeed I know we'd had through the LGA as well, because it's been pushed. And I do remember at the time colleagues sort of impressing the fact that from the LGA, from all parties, saying to the government, you know, are you still intending to bring in this social care reform? That was still very much a case of, yes, we're going to do it. It's going to be a priority, and making sure we're doing that. So rather than having this situation whereby people who might have income too high but otherwise not be subjected to the cap would be caught by it, whereas people would still be on it. And I think also, I was thinking about the inequitability of it, that we've already got an inequitable situation with this cap because it's the only cap that exists in adult social care. There are no other caps. We already got that cap, and my concern was that if we introduced some people who were receiving the services would get a cap, would get their money capped, and some people who were doing the same services would not be capped just because they happened to come in later. I think that would be inequitable in itself. So I think the point, it was twofold. So it was about people accessing the same services, some being capped and some not, and the fact that the government, which had only at that point been in for 7 months, had made it very clear that they were still looking to do adult social care charging reform. So it was a case of, rather than doing that in that way and keeping equitability. So that was the reasoning, if I recall correctly, I'm sure I had the particular, I did have the particular concerns about people accessing the same services being treated differently, and the fact that we were still being promised social care reform. So it was effectively hoping that that you probably wouldn't get many more people coming in anyway.
Yeah, that's what I understand. I mean, I don't want to hog this. I do have a comment on it. I've asked my questions. I don't know if anybody else wants to come in and ask any questions.
Thank you, Graham. Any questions? Matt?
Hi there, thank you, Chair. I was just wondering, was there any discussions about increasing the cap rather than removing it completely?
For this, yeah. So the discussion that the discussions we had was, as has been mentioned in there, was about potentially putting it up by inflation. So that would have had the result of all but one person would be taken out of the cap completely. So the two people there's three people covered by the cap at the moment. Two of them would actually, because of any inflationary increase, would come out. And then you start to get into this really even more difficult situation whereby a cap is only benefiting one person. And then that which there's equitable issues, and then there's equitable issues, and so that absolutely was, but it was really taking the point of view of if you're looking for something which is only going to benefit one person, is that really justifiable? And indeed, it's in the report about looking at just doing it up by inflation. I'll come to that more in my comments as well, but yeah, so that was considered.
Thank you.
Spencer, any questions? No, brilliant. So comments. So Graham, did you want to come back in on your comment?
Yeah, I did want to comment on it. I mean, I did go back and look at the original reports going back in 2011, 2018, 2020, and what I'm a bit concerned about is the lack of consistency of decision making within an administration. I mean, after all, this is the same administration. The cap was put on in 2011. The decision was taken to take it off in 2018. Then the decision was taken to put it back on again in 2020, and now we're back in 2024 and we're taking it off again. This is not really very fair to people, to be honest. People want consistency of decision making, and I understand the issues behind this and the question of equity, which again makes it important that there is consistency of decision making. And I think we've got to a situation now where a promise was made in the last report that this cap would stay until there was social care reform, which is perfectly understandable, but you are going to renege on that now. Social care reform has been under debate for a long time, and even in 2020 when we had the debate in council about this, that was 3 years on down the line since the government had said they would do something. And I have to say, my experience, probably from an academic point of view as much as from a practical point of view, is that governments don't like doing big, difficult decisions, whether it's council tax reform and social care. So the prospect they were going to do anything with Brexit and everything else seemed to me quite unlikely. And therefore, I think the principle that you introduced at the time, that it should be until the care, is now being reneged on, which I think is unfortunate. So from a position of consistency with decision making, I think you should stick with the original decision, allow these people to continue to have the cap, because they will eventually, as you say, drop off the system. So I think from a consistency point of view, I think we should do that. And you could very well say that new clients would not be subject to the cap as was recommended in the 220 report. And given what Mr. Biddle has said, I think that would work effectively.
Thank you. Any other comments? Spencer?
In respect of being able to anticipate or not what the government was going to do in respect of the cap, or just make the observation that Labour were quite clear about what their plans were for the cost on care cap in the pre-election period.
Thank you. Matt, any comments? No. Thank you for your comments and questions. This has obviously been something that's been very long running. since 2018. And I think Graham is completely correct. Now, 2011 was a very long time ago, so long ago that I wasn't a councillor. It was before my first year on the council, and so therefore I will not be, party to, though the administration at the time was the same party as I am, I was not part of that administration and had no, obviously would have no say on the fact that this cap was brought in for this area of adult social care, and yet other areas of adult social care had no cap and have had no cap. So therefore, people who are in other areas of adult social care who are financially assessed to have the means under the National Financial Assessment have to pay the going rate, so to speak, under that financial assessment for their care and support. The 28 decision, as Graham said, it was something that came very soon after I became cabinet member. One of the reasons why that was changed in 2020 was because some of the ways that we went about that, some of the consultation, etc., wasn't done in the way that I was comfortable with. And this equitable solution of coming up with a higher cap, because it was before then was £60, which is very, very low, and coming up with the £250 was seen as equitable. And I think at that time, am I right, it was about 9 people, Andy?
There were 18 in total, so not far off, really.
Yeah, so it was effectively affecting more people at that time as well, with having a £250. It might well be in probably in the papers, but yeah. So I think it was done for the right reasons in terms of 2020. It was also, as I said, on the back of, and indeed the motion to council in January 2020 was off the back. It was a month after the general election in 2019. The Prime Minister at the time, the government, having had under a previous Prime Minister not having done anything for 3 years, they said, we will make it very clear we're going to do this. I think at that time the speculation was 2023 was the time that they would be looking to bring in the care cap. And so this was done very much with that in mind, the 2023 date in mind. We are now a year and a half on from that. We are 7.5 years on from the promise that something, well, we're 7 years on from the promise that something would be done, because we were told in March 2017 that we'd have something in 6 months. We're now in December 2024. We've also now know that we have no cap, we have no national legislation on the horizon, and I think Councillor Gardner is completely correct. The current government made it clear before the election, and indeed has done it afterwards, they will not be making charging reform for social care come in at the autumn 2025 deadline, which I'll be quite honest, I thought was just a case of kicking it until after the election anyway by the Conservatives. But I don't think that this is something in our situation now, in terms of equitability, as I've said, even if we put it up by inflation, it would affect one person. I don't agree with having people accessing the same services being subject to a cap or not, depending on when they first accessed it. And I also have this continual issue that we have a cap which was put in for indeterminate reasons well over a decade ago now, continue to exist just because it's existed in a way that doesn't benefit anyone else in any other care and support in the council. And fundamentally, we are projecting a £3 million overspend in adult social care. This is alongside every council in the country which has massive social care overspends, many much worse than we are, and this is £90,000 that this could bring in, which though small in comparison to 3 million, is still something within the context of the council, cannot be taken away. So I think it is the right thing to do. We would, one way or another, we were going to have to do this anyway. Either there was going to be a national cap comes in, and then we would have to be dealing with it as well. But for me, I was uncomfortable by the cap being in place in the first place. I reintroduced it as a higher level than it had been, because that was more equitable. But when you're making a decision, and as it says in the papers, agreed the implementation of the financial cap be on a temporary basis. Yes, it was until the publication and implementation and anticipated government reforms for financial arrangements for adult social care sector, but that was with the explicit thing at the time that we were told by 2023, and that has not happened. And now there are no anticipated government reforms because there is no plan about what's going to happen. There's been talk about a cross-party review, a Royal Commission perhaps, but there are at the moment no anticipated government reforms. We have no idea if that's going to be in this Parliament, next Parliament, and to be quite honest, this is something that is inequitable and is just something that I'm not comfortable with. And we have this situation whereby it is costing us money. And let's not forget, it's not just the money that we could bring in, it is also costing us money in terms of administration. If you means test things, they become more expensive to administer. And and I know there's a lot of work that goes on with finance colleagues within adult social care who have to go through and assess if you're doing this or not with every family. So you can't just do a financial assessment, you have to do an extra one to see if this is appropriate for this. So all in all, I didn't want to make this decision. If the last government had kept in with its promise that they would do adult social care reform in the timelines they did, we never would have to make this decision. But I am happy to, well, not happy, but I am going to go with the recommendations of number one, that the current financial cap on charging for day services is removed, and that two, the proposed approach to tapering the removal of the cap is adopted. And I hope that what we're doing here in terms of having to do this really does send a message through our local representatives of the governing party that putting off adult social care reform, not having any plan. I do hope when we come to the budget next month that there is something in there there's something in there around that about maybe a Royal Commission or something as well, because we wait to see what our funding is going to be. But I do hope that they do consider that adult social care charging, or social care charging as a whole, really does need to be looked at, and we do need to have some end game on this, because in Portsmouth we won't be the only people making these kind of difficult decisions. There will be other places who will be putting up their charges for their daycare services that they have. There will be other places that will be maybe closing it down and people will only have private options. There will be all kinds of things that will be going on because there is no cap on social care. So I didn't want to be making this decision. I didn't want it to have come to this, but I will make that. I'm going with those recommendations, and that is my decision today. Okay, so item 4. Back to you, Andy, for the Accelerated Reform Fund. Much more happy and interesting. Not interesting, much more happy circumstances, this one.
Thank you. With a catchy acronym of ARF, which I should point out, really. So there's some under point 3. There's some this paper for information and update. We brought a paper around shared lives to a portfolio meeting in the last calendar year, talking about our ambition, and then this paper particularly relates to being able to grow that service. So under point 3, we've got some information about the Accelerated Reform Fund itself. There were around 12 priorities that the previous government asked areas to have a look at. This is a bid that goes across our integrated care system, so that's the 4 upper tier local authorities in Hampshire and the Isle of Wight. And we've chosen the priorities at the base of the first page and into the second page. Community-based models such as shared living, supporting unpaid carers to have breaks tailored to their need, and services that reach out to and involve carers through the discharge process. Southampton City Council are kindly acting as the lead authority, so they are the receiving authority for the cash, and they then distribute it across the other 3 authorities. And you can see at the bottom of that first paragraph on the second page, we have a total of 187,000, no mean amount, to be paid in 2 separate amounts. We drafted this paper a little while ago, so I believe we will have received our second payment, which I think was a query from the briefing. So we're due to spend that in this financial year. So moving on through section 4, we've done some research with our carers and families about what would help and support them, and we've also involved a network called Shared Lives Plus, who are a specialist network nationally who support shared lives and the growth of shared lives in local authority areas. We've focused on shared lives very much because it's one of those models that is nationally, I don't think there are any local authorities that don't have a good rating for their shared life scheme. It's a very personalised model. It enables people with care and support needs to live in a family relationship and have their care needs met, to build up a very solid relationship over time, and to enhance their independence as well as their living in their own community. So moving through into the third page, we've wanted for some time to increase the number of shared life carers and the range of services, so not just a permanent service for those people that live with shared life carers, but also a service that can be responsive to respite care, to short breaks, for people who have care and support needs, and wanting very much to keep people in their local communities. So we've listed some of the uses that we've put the grant money to: a recruitment campaign, a research and development officer, and providing information and advice to carers about the options available for them when somebody's being discharged from hospital. It can be a really difficult time for people. People, in the same way as we access social care, often don't access hospital in a planned way, and it can be confusing and difficult for discharged people with care and support needs, so we're trying to put as much support in as possible. We've also touched in that last paragraph of section 4 around wanting to increase access to direct payments, which is one of our ongoing programmes in adult social care linked to our strategy. Under point 5, we've laid out the statistics around the shared live household in Portsmouth and those people that also provide short breaks. And then moving through into section 6, we've set out the progress to date using the ARF funding and some of the events that we've held. We're really pleased that we've had 9 new inquiries in the time of those events, and we're approving another 5 households, and we want to continue building that service. It's the right environment for people with care and support needs, but it also works out financially as well. It's much more financially viable than residential care, for example, and it gives much better outcomes for those people that thrive in a small person-focused environment. So that's the broad thrust of the paper as an information update on the ARF. Happy to take any questions or comments.
Thank you very much, Andy. Any comments or questions? Graham.
Just a quick question. The additional recruited shared lives officer, presumably they're on a short-term contract, would that be right?
They'll be on a permanent contract. What we've tried to do in previous times is recruit to short-term contracts, and we just don't get people applying for them. So what we say we'll do is recruit permanently and then manage within the turnover adult social care to absorb that individual so that we don't see a redundancy situation. We've sort of done that on probably 9 or 10 occasions in the last 3 or 4 years, and we've always been able to absorb in turnover because we just found people don't apply for short-term contracts.
Well, that's good news. I mean, I think this is a really good initiative. I mean, I think the idea of people being able to live in a more homely environment with support is a really good one. So I think it's a really good support proposal, and you know, really welcome it and hope it will be proved successful.
Any other comments or questions? Fab. Yeah, I mean, it's a great scheme, and Shared Lives is a really important part of our social care in the city. So a bit of narrative, I think we said this at briefing. So this came up, we weren't sure about this, and then we were approached at the National Children's Adult Services Conference 2 years ago, myself and Andy, and by the organisation who, because the local authorities need a third sector partner to take this forwards. So and then they said at the time it was going to be Isle of Wight who was going to lead, and then obviously, as in the papers, it became Southampton, because you have to do it on an integrated care system footprints. That is how you have to do it, and then obviously you can do your own schemes within that, but you all have to sort of do it in a similar area. So obviously we did it in Shared Lives, and it's been just any way that we can improve and expand our Shared Lives offer is really, really key, really important for anyone watching. It's very much like fostering, though, for adults, and the spread of it can be extremely broad. So you can have people who are in various stages of need, and then they can live in people's houses as part of their household. So I'm really pleased it's going forwards and working extremely well. And as per Graham's question, I think one of the things that we have done significantly under this council, and particularly under this administration, is really made sure that that we can keep our turnover of adults of social workers, people who work for adult social care, to a much lower rate than we get in other authorities around the country. When I talk to my colleagues across the country, a lot of them have our turnover for social workers is really bad. We can't retain staff. In Portsmouth, we have a much lower rate of that than other people, and one of the reasons is we don't keep flogging a dead horse and trying to recruit people on short-term contracts, and then because we do have some turnover, and actually you're going to be able to retain. So unlike some of my predecessors, or my direct predecessor prior to 2018, apologies for this, Spencer. He was always keen to shed staff, whereas we've always seen it as being an important thing to try and retain staff at the council, and see it as a really good employer. And I think that really has sort of shone through the way that our attitude, both of the administration but also for the officer corps, in terms of making it a good environment for people to work, and actually really valuing them and saying, if you know the funding for this is coming to an end, but we will support you to move into another area of the council and therefore stay within adult social care. So that's been incredibly positive. But you might not expect anything less from a party that wants free social care for everyone. So free personal care rather for everyone. So obviously this report's just for noting, but obviously Andy, can you just confirm as to when this funding comes to an end?
Yeah, so it's spent over 2 financial years, so it needs to be spent by the end of this financial year, which will be 31st of March 2025.
Brilliant, thank you very much. And obviously this will, I think one of the really important things about this with Shared Lives is that it really gives us the opportunity then to boost it through into the future. So it becomes so it's very much a case of almost your seed funding to really build it up, and then it can continue on and become self-sustaining rather than just it's a chunk of money that then is gone. And that's the whole idea of the Accelerated Reform Fund. And indeed, let's spread it around a bit. But this came through in the previous government, and it was a really important. It was one of those things. Every government has something they do well, and I think actually someone within the Department of Health and Social Care did have the foresight that this was a really good idea to do. Not a huge amount of money between 4 authorities, but something we can really make work, and a little bit of funding goes a long way in this case. So really pleased to hear the report, and so that report is noted. And that's the end of the meeting. Thank you very much, everyone.